Hi, my name is Victoria Morgan, and I did my Level 1A fieldwork at Fort Bragg Schools. The diagnosis I did my case study on was global developmental delay. This diagnosis is typically given to a child who's under the age of 5 and they're failing to meet expected developmental milestones. These milestones could include crawling, walking, and talking. It's also used when standardized testing is not a viable option due to the age of the child. So the client I did my case study on is a 4-year-old male who's an Army child. He has two very supportive parents. He's currently enrolled in a half day pre K program 4 days of the week, and his classroom environment is with other children his age who also have different disabilities. His past medical history is a bit extensive as he was born at 23 weeks gestation. He was intubated for months, resulting in vocal cord paralysis. This means he kind of has a bit of a raspy voice and can't exactly swallow too well. He also has cerebral palsy, so he does have a bit of muscle weakness. He also has congenital nystagmus, and that affects his balance. His precautions is that he has a G tube inserted, so this is how he receives his nutrients. So if this comes out at any time, the nurse has to reinsert it within 30 minutes, and the parents must be notified as soon as it comes out. He does not take any medications at school, so no medications are listed on his IEP. The client has developed a lot of socialization skills since he's been enrolled in this pre-K environment, and he also is a bit of a rule follower, so that helps with him listening pretty well. His current interests are he enjoys building toys, he likes socially interacting with his peers, he likes going outside, and he really enjoys swinging. His impacted occupational performance areas are his ADLs, as he's unable to dress himself, unable to bathe himself. He can't exactly feed himself due to the fact that he has that G tube. His parents do send him with a very soft snack that can kind of melt on his tongue so that he can participate in snack time like all the other kids in his classroom. So that's really awesome. His IADLs are affected, his play is affected because he can't be too rough because you don't want that G tube to come out. His education, as he's not developing as he should, his motor skills, process skills, and social skills are also affected. So OT's role in the school is to kind of facilitate positive behaviors and create the most academic achievement as possible. They try to help identify any barriers that are present in the school and to kind of help adapt to those barriers to facilitate a positive environment to help with participation in school routines. They're not just working with the students, but they're also working with the teachers, the parents, and other staff members as well. So this client was given the Peabody Developmental Motor Skills. That was at the second edition. It was done at an outpatient clinic over a year ago. So these were the results that were found at that assessment time. His total fine motor was at 8th percentile. He needed full assistance with getting the scissors in his hand and able to snip at the paper. He was not able to string any beads at the time. His current goals is that he is to demonstrate improved visual skills utilizing a functional pencil grasp in 4 out of 5 trials, and also demonstrate improvement in donning scissors independently and snipping at paper with increased safety awareness in 4 out of 5 trials. The frame of reference that's commonly seen with this diagnosis is the developmental frame of reference to help with those motor delays. It is not exactly looking at what the client cannot do as much as it is looking at what the client is able to do, which is really awesome because it helps create autonomy in that client. It helps promote growth and developmental areas to bridge the gap between where they are and the expected ability. And so this could be with adaptations in their environment. And so this was actually seen in a therapy session. The scissors that are down at the bottom is an adapted scissor that he's currently using to help engage him in utilizing scissors and then get him to the goal of using regular scissors independently. Play is a primary occupation for these children, so typically you try to make the intervention pretty fun as much as possible. So since he is working on that functional grasp, we utilized an easel to kind of prop his wrist up to engage his wrist extensors since he is a little weak. And he was coloring his favorite Paw Patrol character. So we're trying to work on pencil pressure and a functional grasp. And he also is working on utilizing scissors, so using those adaptive scissors. He was cutting at paper that was kind of making graphs with those cuts. He loves swinging, so at the end of therapy, he was doing a task of stringing beads onto a wooden stick. And this was when the swing was not moving, just working on that trunk stability and control. There was standby assist in case. And so he was able to string the beads onto the wooden stick, which is obviously a lot of improvement from his evaluation measures, but he was not able to follow the pattern and create that sequence. So he does work on a lot of like fine motor skills in this to kind of help get him where he should be for his age in the school system. With the use of these motor skills, it can help him develop those skills needed in school. And that was kind of what we did with the client. I had a great experience at Fort Bragg Schools. I had a great fieldwork educator who taught me a lot. The kids were super cute. We were able to see elementary and middle school. My favorite was definitely working in the pre-K room. I loved it, and it definitely reinforced my idea that I would definitely probably want to seek out pediatrics in the future. Thank you all for watching, and I hope you all stay very healthy.